I do think it's made patient care more efficient for those who are, like I say, are frequent exacerbator kind of respiratory patients. The sort of virtual health pathway that we use, sort of tier 3 patients for monitoring their observations once a week and that kind of thing is really useful. Means they've got access to a clinician. They can, well, they can take care of their own observations. They can take care of their own self-care and look after their symptoms that way. From our point of view, from a clinician point of view, it's really good because we can, we can see what they're doing from a weekly basis. We can monitor sort of any deteriorations and see how they're getting on. But I think it just helps to be a little more connected to the patients as well. I think ease of it, it's quite nice. Like, so you log onto it, you get a list of patients straight away of who's submitted their readings, who's triggering, who's okay. You can triage patients. It's really user-friendly from that point of view, and I think it's user-friendly both ends. I think we have a lot of feedback from our patients that they, some of them are quite tech-phobic, and actually they find it quite easy to use. It's 15 minutes, 10-15 minutes in a day once a week that they just have to input their observations, answer a quick questionnaire. We can check at the other end and make sure everything's okay. And like I say, from our point of view, like being able to triage people, you can see who's highlighted, you can see who's like low intensity, and you can triage it. We can make sure, and then all the information's displayed like really nicely as well. And it's just helpful from that point of view. Like say people that might say they're feeling worse and that kind of thing, they can sort of see it themselves. But I think patients being able to highlight when they need a call is quite useful, but also using the messaging features as well is quite simple. It's quite nice because you can send a message to a patient. They might say they got a bit of a worse cough, but everything's okay. You can send a quick message and just ask a few more questions without having to do a complete phone call with interrupting their day and that kind of thing. They can message you back whenever they want. Obviously, if somebody's really unwell, we will trigger a phone call, but it's one of those things that I think that messaging service part of it is actually been really useful for sort of patient care. Being able to refer a patient takes like 15 seconds, 30 seconds. Put their NHS number in on the spine, it loads up all their information. You put in their number, you select what pathway you want them to be on. And then that's it, the referral's sent, they're all ready to go. You can then adjust the parameters for their observations if you need to. And then it's just about monitoring them after that. There's no real, that side of things is really quick and easy. The Doccla team are quite responsive, so things that we started this project and things were, you never know how something, you're going to have teething issues when you start something, so you never know how something's quite going to work. So we started with a broad kind of, this is our questionnaire, these are the observations we want to get, and this is what we're going to do, we're going to roll it out, and this is the information we want to find. Going back to Doccla and say, actually, we want to change this or we want to do this, actually that's quite responsive, that's quite nice. And I think actually patients have really commented on the customer service end of view. So if customers the patients are having an issue with the technology, the app, or it's logged them out or something like that, it's something I can't fix my end, actually then being able to phone Doccla, I've not had, well, no, I've only heard good things basically. I would say just do it. I think these kind of software and this kind of technology is really, really useful for patient management. It's transformed the way, like I say, we monitor our patients and look after them. So, if you're a service that's definitely like inundated with phone calls from patients that are unwell, needing a lot of input and a lot of advice, then I think this is kind of something that will really help tackle that, because like I say, it puts the onus on to the patient but onto the clinician as well to review those patients. The patients know they're being reviewed. They don't need to call in and they don't need to bother the service, because they know even just a quick tick a box, and they'll get a message received to say your observations have been reviewed, they're absolutely fine, and I think they're happy with that. It's just that reduces that anxiety level, I think, for a lot of patients.